is running, but do like to watch on catch up. So if you don't want to appear on the recording, if you do just switch your camera off, you do disappear from the recording and can listen in and participate in the chat a little bit later on. And so with that in mind, unless you're either presenting or we're inviting you to pose your question or a comment, if you could keep your microphone muted, it does limit the background noise, because Teams is very good at picking up people washing dishes or rustling papers in the background, which can be a bit distracting for those of us listening to the presentation. So another point that's probably worth mentioning really is these are of course general information sessions designed to promote an understanding of the service that we offer. So unfortunately we can't address any questions that you may have about your own personal circumstances or those of a friend or a family member. If you do any of those questions or comments, then our patient advice and liaison service I'm sure will be available to assist you in getting an answer or getting a response, and we can provide some contact details for panels, that service in the chat to make sure that you get an answer. And then just a really practical point, I am nearly finished, honest. We are going to try and give everybody the opportunity to contribute. So if we do have one or two people with lots of questions, we may ask you to wait just so that we can bring everybody in to ensure everybody gets a chance to contribute. So that's it from me. I will now hand over to Fiona and Nicola to introduce themselves and to take us through their presentation. Thanks very much.
Thank you, Richard.
Thank you. It's really lovely to be here. We're going to present to you about our long-term health conditions team. I'm going to share my screen in a moment, and I'll let Nicola start, and then I'll take over the reins halfway through. But yeah, if you have any questions throughout, please feel free to ask. I think there's the chat function as well that's enabled. If not, there'll be a section at the end to answer as well any questions you might have. So let me just share my presentation. Bear with me while it loads. Okay, is that okay, Nicola? Can you see okay?
Yeah, that's perfect. Thank you very much for that. Yeah. So we're a newish service, NHS Northamptonshire Talking Therapies Health. We have had a recent change of name from IAPT to Talking Therapies. And we are the long-term conditions part of Talking Therapies. We were originally called the Diabetes Psychological Wellbeing Service up until about a year ago, and then we merged with IAPT, and then with the new service name of Talking Therapies we have become Talking Therapies Health. So while myself, Nicola Phillips, I'm a CBT therapist and clinical lead in the team, along with my colleague Fiona French, who's a clinical psychologist and also a clinical lead in the team, will be presenting to you today. So what we're going to talk about today is a little bit about who we are, the people that we can support, common reactions that people often have who've got a long-term condition, how our service works, our place on the stepped care model, which I'll talk to you a little bit more about when we get to that, the level of support that we offer. So we offer a step 2, which is our low intensity intervention, and step 3, and we'll also be talking about the therapy that we do offer towards the end of the presentation today. Okay, next slide please, Fiona. So who are we? Well, we're a team of psychological practitioners who've got some additional knowledge and understanding of challenges experienced by people who are living with a long-term health condition. And this is from previous work experience, but also from extra training that we've had. We offer evidence-based treatments, and this is via video call, over the telephone, and also face-to-face sessions. The sessions can be held on a one-to-one basis. They can be held in a group or also via a webinar. And we support people living with a long-term health condition such as diabetes, respiratory difficulties such as COPD, cancer and cardiovascular difficulties as well. And we work with people across Northamptonshire, so that would include Corby, Kettering, Wellingborough and Daventry. So who can we support? So we work with people aged 17 and a half upwards. They do need to be registered with the GP in Northamptonshire for them to access our service. And currently they do need to have a diagnosis of one of the 4 that I previously mentioned. So diabetes, respiratory difficulties, cancer or cardiovascular problems. We are looking to expand on that, but currently we've got funding to cover those 4 areas at the moment. If someone was to come into our service and didn't have one of those 4, they would be seen in our wider service, so talking therapies. They could access support from them. They also need to be experiencing some emotional distress, so looking for some support with their mental health. So these are some of the common reactions that we get from the people that we work with. So struggling with their self-identity, you know, I was healthy and now I'm ill, and being in a completely different place to where they were before, and experience a sense of loss. And this happens a lot. You know, I'm not the person I used to be. I can't do the things that I used to do. And frustration and anger often comes with that. You know, it's not fair. And quite often low mood. I've gone from being the breadwinner to not being able to work at all, and thinking and believing that they're useless. Quite often anxiety is a common reaction as well, struggling to relax, struggling to come off guard. And guilt as well, you know, it's all my fault. If only I'd have looked after myself better, if only I'd have done things differently. That can bring up a lot of guilt in people. Worry about managing themselves, also about the future. I have to change my whole life. What if I can't manage? What if things get worse? What if I don't get better? How am I going to cope with family life? So often long-term conditions can bring about a lot of worry for people. And a sense of helplessness and vulnerability. There is nothing anyone can do. My body is out of control. So people feel like they've got no control over their lives when they're living with a long-term condition, especially if they've experienced a lot of changes in their life because of that long-term condition. So how does our service work? So some people can self-refer. They can do that by calling in, and we'll share the details of that towards the end of the presentation. So they can call in, they can email, they can attend what we call a welcome webinar, which is to find out more about our service and what we offer and how we can support people. Or they can complete an online booking form through our online link. Or they can be referred by a health professional, so such as a diabetes nurse. They can refer somebody in who they believe would benefit from support from us. Obviously, they would have had to have had that conversation with the person and agree to be referred in. They would then attend an assessment appointment. So we'll call the person, we'll book them in for an assessment appointment, and then at the end of the assessment, we'll discuss with them the next step. So what's going to be the best support for them? What are their goals? What do they want to get out of therapy? And then we'd look at setting that up for them. The treatment that we offer is evidence-based, and it's NICE recommended. And we follow the mental health stepped care model, which I'll share with you in a moment. And we support people at step 2 and at step 3 from the stepped care model. So this is the mental health stepped care model. So step 1, so this is generally where people would receive support from their GP for mental health. So we're looking at quite mild, low level need for support at that stage. And then step 2, we're looking at mild to moderate presentations, and we would offer a lower intensity level of treatment at this point. And then we also cover step 3 as well. So this is for moderate to severe symptoms of mental health. So this could be depression, anxiety, trauma, OCD, phobias, and also adjustments and struggling to accept a long-term condition. So step 4, this is where we would signpost to community mental health team. So that's for people where the risk is higher, and also their presentation is perhaps more severe or complex, And then at step 5, that would be for inpatient, or that would be our urgent care and assessment team. They would sit at that level.
Lovely. Okay, so I think I'm going to take it from here. Thank you, Nicola. So like Nicola said, we would come in as a Talking Therapies health team and support people at that step 2 and step 3 level. So just to go into a little bit more detail about what that would look like. So at that step 2 lower intensity part of the model, it's mainly underpinned by cognitive behavioural therapy, or CBT. And it's informed guided self-help, and it's delivered by our psychological wellbeing practitioners, or PWPs we call them. So again, the sessions can be offered in a variety of ways. So it can be one-to-one, either face-to-face, over Teams, or phone call. So we really do still have quite a mix of sessions that we provide post-COVID. And again, it can be in a group face-to-face as well, over Teams, or we provide webinars as well. And there is the option to have computerized CBT guided self-help as well. So for step 2, the treatment protocol tends to suggest between 6 and 8 sessions. But all the cases are discussed regularly in supervision, and if it was felt that after that 6 to 8 sessions the patient would benefit from maybe a higher intensity level of support, they can then be stepped up. So they could have their 6 to 8 sessions at step 2 and then go on to have another set of sessions at step 3. So step 2 is, like I said, underpinned by cognitive behavioural therapy. That is the primary model we use at that step. So what is CBT and how can it help these patients? So CBT very much works on the belief that it's not a particular event or situation in itself that causes the person distress. It is actually how the person views that event and distress and situation in terms of their distress. So in that, it then suggests that actually a person's thoughts, emotions, physical sensations and behaviours will all influence each other to maintain that low mood or anxiety. So we know that just by telling yourself to change your mood, it's pretty difficult, it's pretty impossible to do that. But what CBT provides is a broad range of tools to change the things you do and to help improve your mood by tackling those thoughts to change that overall cycle. So just a caveat as well within that is cognitive behavioural therapy that we would use, it is a little bit different to counselling. So sometimes when people come into the service, they perhaps expect that type of therapy. And actually, where counselling, it uses a less direct approach, and the focus is very much more on listening, being empathic and encouraging. And even though CBT practitioners do also use all these fantastic skills, what CBT does is have the main goal is to help the client to change their behaviour and to alter those negative thinking patterns. So sometimes people find that a little bit disappointing, that it's not more of a sort of a talking backwards and forwards, it's a bit more pragmatic. It is actually the most beneficial thing that's been found to help with anxiety, depression, phobias and OCD, especially in long-term health conditions. So then going on to step 3, so this is a little bit different. So even though this is also underpinned by CBT principles, we do also have other therapeutic modalities that we use. So some of our practitioners in the team are trained in different therapeutic modes. So counselling for depression, interpersonal psychotherapy, and then EMDR, which is a type of trauma therapy that reprocesses difficult experiences and memories that people have using eye movement desensitization. And all the practitioners that are working at that step 3 level have also completed additional training to support people with long-term conditions. So there are 2 therapies in particular, compassion focused therapy and acceptance and commitment focused therapy, that help people with long-term health conditions, and they've been shown to be very effective in supporting people at that higher intensity level. So treatment at that step 3 level is delivered by practitioners who have that higher level of qualifications. So our step 3 practitioners are our cognitive behavioural therapists, clinical psychologists, occupational therapists. And in that, we're able to provide actually longer sessions, so up to an hour, and also up to 20 sessions. So it gives us the opportunity to really do an extensive piece of work with someone using those different therapeutic modes. So I'm going to talk a little bit more about those 2 extra therapies that we do, just because a lot of people haven't heard of these before, but they're actually quite helpful to know about with respect to long-term health conditions. So acceptance and commitment therapy, or ACT as it's known, is very much the principal goal of it is to teach the necessary skills to overcome very painful thoughts and emotions that people have, and to gain meaningful insight into what truly matters. So the main ways that it does this is by focusing on these things you can see here on the screen. So we've got the values of a person, so what really matters to them in that moment. Committed action, so pursuing what's actually important to them. So if you think about someone who's been newly diagnosed with a long-term health condition, or perhaps has a terminal illness, focusing on these things to keep them in the moment is very much helpful. So again, being present, being aware of where you are in that moment. Diffusion, so creating space from your thoughts and feelings, those very negative thoughts and feelings that you're inevitably going to have when you're going through something like this. Observing experiences and not getting caught up in them too much, so very much observing what's going on, and then ultimately leading to acceptance of what's going on. So whether it's acceptance of your new identity, which incorporates your long-term health condition, or acceptance of perhaps something like a terminal illness. So that's one therapy that we would use within the step 3 level. And then another one we use is compassion focused therapy, or CFT, which was devised by someone called Paul Gilbert, who's done lots of fantastic work around this area. But his main the things that he focused on are these 3 sort of systems that we use to manage mood. So CFT very much focuses on regulating our mood to provide comfort. So all of us day to day, we tend to flick between this sort of threat system and drive system. But what can happen is those systems can override what's going on in our brain and body and really push those feelings of anxiety and stress. So if you think of someone with a long-term health condition that's been newly diagnosed, particularly someone maybe that's got a terminal illness, that threat system will be in overdrive. And what we're trying to do within compassion focused therapy is really encourage that soothing system to overtake the threat and drive system. So to really slow everything down, soothe those difficult emotions, and help the person to regulate a little bit better. So it's just a little snippet for you to see what it is that we do at that step 3 level. That's a bit different to what goes on at step 2. So then referrals, like Nicola said earlier, there's a few ways that you can refer into us. So people can self-refer, or a professional can do it for them. So we have our generic email that someone can email in. We've got our telephone number, and then we do also have the website where you can either do the online referral form directly there or do the webinar. So that's our referral way. So that is the end of our section for that. So we're more than happy to answer any questions, go over any of the slides. I'll come off this so I can actually see people properly as well. Let me see. There we go. So thank you very much for listening to us talking about Talking Therapies Health. And yeah, if you've got any questions, please feel free.
Thanks very much. Yeah, really interesting to hear about the sort of breadth of the service offered and how to refer. So I know we've got one question already in the chat, and I can see that Sheila's starting the bidding with her hand as well. So let's take Ranjit's question first, which is, are the treatments delivered in a culturally diverse way?
Yes, very much so. So when people have first come in for their assessment, that's part of their assessment. That's done for the person. So we very much identify what's important to them, for a whole breadth of things, really. Diversity across the board. We also have things like interpreters as well available for people that perhaps English isn't their first language. So we're very much aware of the things that that matter to people, but it is a person-centered approach, particularly in long-term health conditions, because even though we might have 10 people with diabetes, every presentation is so different and what impacts them is so different. So we have to be aware of what's important to that person.
That's great. Thank you. Let's come to Sheila next. Sheila.
Yes, thank you. It occurs to me that there are long-term conditions that never get mentioned because obviously they're not the most obvious ones. If you have one, then maybe it's very easy to manage with help. If you have 3, 4, and perhaps 5, and I understand that long-term conditions are conditions that can be treated but not cured.
Yeah,
put it that way. And I think those people get lost. They need support, but what sort of support do they get? Because to each consultant, to each GP, it's an individual condition.
yeah.
They don't think about the whole. So do you do anything to help people like that?
Yeah, so I guess, Sheila, that's why our service has been set up, because it's recognised that people who have got a long-term condition, and you're right, many people who've got one can sometimes have several.
Yeah.
Unfortunately, it's not just one that they're living with, which is why our service has been set up, so we can support that person, because it's recognised that quite often it will impact their mental health as well. It will cause emotional distress as well. It's not just the physical aspect they're living with, but it's how it impacts their daily functioning, their mood, their self-esteem, their anxiety as well. So it's really why our service has been set up. We are focusing on those 4 that we mentioned at the moment, but we are due to expand, and we will cover other long-term conditions. Currently, if somebody is living with a long-term condition that doesn't come under one of those 4, they could be offered support within our wider service, which would be able to offer up to 20 sessions of therapeutic support as well.
Thank you.
Thanks very much. So we've got another question from Susan here, which sort of resonates with some of the discussions we had at a previous webinar where we were talking about carers, whether they would recognise themselves as carers or not. And so Susan asks, what about family members of the person diagnosed with the long-term condition? Are they offered any support from the service too?
Unfortunately, not our service, but our core service would be able to support family members. So if a family member was struggling with their mental health or felt overwhelmed, distressed because of the support they're providing their relative that's got a long-term health condition, they could be supported by the Talking Therapies core team, but we wouldn't specifically be able to work with the relative.
Okay, thank you. A thumbs up there from Susan, which is great. We've got a question from Catherine. Catherine.
Hi, hopefully you can hear me, even if you can't
Yes.
see me.
We can, yeah.
Good. Good. Obviously you mentioned the 4 conditions, COPD, cardiovascular, and diabetes and cancer. I just want to ask about the cancer diagnosis, because obviously for some people, is it classed as a long-term condition if they've had a cancer diagnosis and then they've had treatment, so therefore they're in remission? Can they still access the service under that?
Yeah,
if they're like 2
and
years
probably,
in remission, or
this comes up a lot, Catherine, and we probably should have said it, made that a little bit clearer, but yes, so they can come access our service even if they've had cancer several years ago and they're in remission. There's a lot of research to show that people who've gone through that cancer journey often will experience higher levels of anxiety about the cancer reoccurring. And we are offer a really good sort of support service for people who are in remission and experiencing anxiety about it reoccurring. So yes, we can, Catherine.
Oh, that's good. No, that's good to hear. Thank you. Yeah.
Very much. So I think Ranjit had a similar thought to me, actually. I was conscious it was a relatively new service. So have you had some successes so far, and actually how are you measuring your results?
Yeah, we have actually. In the short space of time, we've had, obviously, anecdotally, people have been very positive about engaging with the service and feeling very supported. I think, similar to what Sheila was saying, it's, you know, there's not a space necessarily for people like this, and it's quite individual when you have a long-term health condition. Where do you fit in terms of mental health presentation? Who can support you and understand? So I think it's been quite helpful for people, particularly some of the groups we run as well, to meet other people with long-term health conditions who are struggling with their mental health. I think it's been quite nice for patients. In terms of feedback, it's an interesting question, because I think we're in the process at the moment of changing the way that we get our feedback. So we used to use I Want Great Care, a particular way of going onto a website and filling out a really straightforward questionnaire. I think it's still just about finishing off, it's tailing off, but we're introducing a new way of gaining feedback, but it will be a similar system. It's something that we send out with our discharge letters or end of groups, and it's a way for patients to feedback. But often patients do also email in and just say, you know, if they've had a positive experience, and we do collate that information as well.
Lovely. And that's
we also collect measurable sort of data other ways as well. So along with sort of talking therapies, they are required to collect MDS results.
Yes.
So that's looking at symptoms of anxiety and depression, and we work very similar to them. We would collect that throughout treatment as well.
Lovely. And I can add to that, knowing that a lot of that information will then flow through to management teams and ultimately be available to governors. So actually, in terms of people scrutinising how's the team doing, there are opportunities there as well. So thank you. And an additional question, I guess, that people might be also wondering, what happens after 20 sessions? So if somebody is still needing some support, is there any offer that we can provide after that time, or what happens then, I guess?
Yeah, I mean, in terms of the specific 20 sessions that they would have, that would be a set piece of work that the person would have. As my understanding, Nicola, is that if they then become discharged from the service, which they would, if at another point they were struggling with their mental health and a long-term health condition, they can be re-referred back into the service. It's not just a one-shot approach. So we recognise that with long-term health conditions, if you take diabetes alone, you know, someone lives with diabetes for the rest of their life. So there'll be different triggers at different points of their life that will impact on their mental health. So we do recognise that and very much see it as a service. And within our discharge letters, we do say, you know, if you feel you need support again in the future, please get in contact and you can re-refer. So yeah, they can have another, I think probably not straight away, like not within a couple of weeks, but yeah, they can come back and have another treatment session.
That's really good to hear. So I can see we've got a couple of hands up. So let's see. Catherine, I don't know whether that was your original question or whether you had a follow-up question. So I'll just come to you first.
I think it was my original question, but I have thought of something else. So
go for it.
Unfortunately, obviously, we hear a lot of stuff about waiting lists and that. So I just wondered, if somebody does self-refer, how long it is before they get to see somebody.
Yeah. So for our assessment, to be booked in for assessment is a couple of weeks. To start therapy at our low intensity, our step 2, again, it's probably a couple of weeks. It's very short, the wait list there. But for our high intensity, so our step 3, the wait at the moment is currently 3 months.
Okay.
Which in the context of general psychological services is incredibly
really low. Yeah.
Yeah, it's really low, because we know that some of the wait lists, you know, can be over a year, if not up to 2 years. So it's 3 months and that's probably our longest at the moment. We've recruited recently as well, so we should have that come down quite soon. The step 3.
Yeah. No, thank you.
Great, thank you. So before I bring Sheila in, I'll just pick up a question from Tracy here in the chat. You mentioned groups. Whereabouts are they held across the counties? Is this something that's particular to individual areas? And are they on Microsoft Teams as well, or is that just an in-person offer?
Yeah. So the groups currently are over Teams. It might be something that we do look at of offering them face-to-face, but yeah, currently they are being held over Teams.
Lovely, thank you. Let's come to Sheila next.
Yeah, we will get face-to-face one day. The conversation has sort of jogged my memory years ago, pre-CCG, even when we were primary care. I went to, I think it was over 6 months, I went on a course living with long-term conditions, and the people who were in the group all had different long-term conditions. And we all shared how we managed what we were living with, and found a lot of similarities in symptoms and how we thought about things. And each time we met, we had to set ourselves a goal to get to before we had the next meeting. And I'm just wondering if that sort of thing would help with a follow-up to some of your treatments.
In terms of having a group meet up.
So like a peer support, do you mean, Sheila? With
yes. No, I mean, it was advertised and various people applied for it. I think it was a little bit of potluck who went, you know.
Yeah.
And it was something that interested me.
Yeah.
Because on a personal level, I've had for a long time an underactive thyroid and pernicious anemia, which are quite difficult to deal with together. And I just wanted to talk to other people who had same sort of, not the same, but similar problems in their lives, and find out how they managed it. And it was great. And I remember one young man who was in his 30s who had had a stroke. And he used to set himself goals about how far he walked every time we met. And he really was walking quite well. And he said it was because we all encouraged him to get his goal eventually. I think that sort of social, well, it was sort of social, but not, if you know what I mean. It was a mixture of really, in the first instance, unidentified people who applied to go on the course. So nobody really knew before we started who was managing what. So.
Yeah. And that setting goals, Sheila, is something that we do within our group. So within our COPD group, we'd set goals, and people would be aware of others' goals and support them. So I think we probably do something similar to that, but I quite like your idea about the peer support as well. Might be something we look at, Sheila.
Yes, it's, and you can imagine that I'm always talking about something or other, so
I think it's a really interesting point, isn't it? Because we've talked a lot within the broader trust, I guess, really, of the work that the Recovery College is doing. And I guess it strikes me that particularly people with a long-term condition, whether it's a long-term mental health condition or physical health condition or both, as somebody was saying about multimorbidity, there is potentially some opportunity there, isn't there, to explore some of the learning that our colleagues in adult mental health services are doing about, as you were saying, Sheila, learning from people's lived experience of long-term conditions, some of which I guess will be condition agnostic. It will be similar experience irrespective of condition. So, as you say, that is something I guess we could take forward as a trust through the Recovery College, perhaps. And I was also thinking about the work that we did with James Finley on the breathing space for people with COPD and some of those sorts of things, actually, which was bringing people together and sharing experiences. So yeah, really good idea, actually. Thank you. And I guess I can see we've got Catherine potentially with another question, but let's just pick up this one from Tracy, which is there an equivalent service for children and young people who have long-term conditions below that sort of 17, I think it was 17, wasn't it, threshold?
Yeah, sadly not in terms of a combined service that like we offer, but there are smaller teams. So I know that there's a pediatric diabetic service that's offers psychological support for young people with diabetes. I'm pretty sure there's something within cancer services as well. I'm not sure with cardiac and respiratory. I wouldn't have thought so because I don't know if there'd be a remit for it, but it would be more individualized, smaller teams that provide that sort of service rather than our bigger service.
Hey, thanks very much. So whilst people are thinking of any final questions they may have, I guess I was just going to ask a question, if I may, about step one, which I guess is in some respects prevention. And clearly there's multiple tentacles that I guess your service has into various different disease pathways in acute care and out into primary care. But I guess what's happening on the prevention front? Are you linked in with initiatives like the Great Dream programme or with some of our voluntary sector agencies, or if not, are there any plans to do that, I guess, into the future?
So we're linked in with like the ICANN groups that are set up as well. So I guess they would sit at that level, and we do, visit them, and get referrals straight from them as well, Richard. So yeah, as we are a new service, we're very much looking to link in. So like with Breathing Space as well, you mentioned, it's trying to get those links so there's a smooth transition from people who are perhaps starting to become aware that they're struggling with their mental health, and so they're directed to us sooner rather than later.
Yeah. And having an awareness as well of like you say, preventative measures. So I know we'd had a discussion with the main core talking therapies lead about possibly going into schools and community centres and trying to target young people in that way as well, more for an understanding of long-term health conditions as well, if they have peers that have diabetes or what have you, but also as a preventative way of, you know, managing your mental health when you're struggling with your physical health, and educating, I suppose, and targeting that way. So yeah, it is something on our radar. We have lots of things we'd like to do.
We've got
And
loads
it's
of things. I guess our diabetes transition group would actually be that, Richard.
Yeah.
So we've set up a diabetes transition. So this is for young people who are going into adult diabetes team. And it really is aimed at, you know, perhaps preventing them getting to a point where some of the older people are coming in and really struggling with their mood, sort of giving them the skills before they get to that point.
Yeah.
So
that's great to hear, actually. And I think Pat's got a hand up as well, but I noticed it sort of links in your sort of, it's great to hear about some of the ideas and developments that you've already got, I guess, which will be good to explore, I guess, subsequently. But I think Pat earlier was asking about how can we sort of share information about this new service with colleagues, a bit like Sheila was saying, really, people that maybe aren't aware of what the offer is. So I wonder whether you can respond to that one, and then we'll perhaps bring Pat in case she wants to expand on that or ask a related question.
Yeah, we have a nice shiny new leaflet which was recently finally signed off. So we're more than happy to send that out if people do want to pass that on. That's not a problem. And obviously we'll share the slides from today as well, which has got our contact details on it. So there is also a link to the General Talking Therapies webpage. There is a long-term health conditions section within that. So that's got information about our team and what we do as well. But yeah, more than happy to share the leaflet.
That's great. So shall we bring Pat in next?
Hi, yes, sorry. Apologies for joining late. But it is quite interesting. What I wanted to expand on is the fact that I know that there are certain groups that have, you know, meetings anyway with carers and stuff like that. So it's more sort of trying to inform them that this is available as well, because some people do have long-term, you know, health conditions and stuff. And also making, you know, the Silver service, which is the Silver ambulance, aware of that as well, so that when they are dealing with people like that, they're aware to sort of refer that. So that was my sort of thinking is, and even on the like Berrywood on the wards and stuff like that, just making sure some people are aware, because there could be people who have that, not, you know, in conjunction with suffering with their mental health, if that makes sense.
Yeah,
so that's what I was looking to do.
Yeah,
and I'm
that's
going
really
to
helpful.
yes, if I could get that, because I've actually got a group as well tomorrow that it would be useful to pass on to, that I'm thinking about. So that's what
Yeah, that's
Thank
really
you.
helpful. Thank you. Yeah, we're very much at the stage of, I mean, Nicola and I, our main job really is getting out there and going to different groups and meetings and making our service known, really. I suppose that's a big part of what we're doing, just to get referrals in, because we know that there's a need for it. It's just making people aware of where we are and what we do and how to refer. So yeah, that would be great. We'll send those bits out.
Okay. And on the peer support stuff, because I actually did that course at the Recovery College, it's really actually really good, because what it does is it actually helps you recognize and be able to use the right language and stuff. So I think if you could sort of do some sort of co-production or something with them, it's also something that we could then also, you know, talk about within these groups as well, if anybody was interested in doing that. So you're kind of spreading it even further, because there's lots of people with lived experience, as Sheila was alluding to, that we can do. And it is worth doing, because it really did help me in terms of when I'm now speaking to, you know, people that I am, you know, governor for, you know, it helps you use the right language and all that kind of stuff. So I would really encourage it.
Yeah, no, that's definitely worth us thinking about. And we are looking to set up a co-production team to almost give us advice on groups, on our letters, on, you know, just really, I guess, how we're doing things. People who've actually gone through, had our therapy, been through the service, so they've got that lived experience, and then can to add into it. I think that would be really beneficial. I know that's something they do in our wider service, so that's definitely something we want to replicate in the long-term conditions team as well. Thank you for that, Susan. It's a really good suggestion.
Marvellous. So thank you. Yes, we'll certainly get some information out on that front, particularly Pat, with your meeting tomorrow. We'll try and make sure you've got that. And I know that we've got a number of people representing different parts. We've got some NHFT governors, I guess, on the call, and I know Sheila has a connection with KGH, so I'm sure we can spread the word, as it were, around this service through these networks. But Sheila, did you want to come in and ask a question?
Well, I was going to make a suggestion, actually. You're saying you want to get out there and let people know what you're doing. Actually, I'm Health Watch Advisory Board as well. So for them, I go to the ICANN People Advisory Group meetings, and we have presentations from, well, everybody who wants to come and tell us about what's going on. So Mark Major leads that, Northamptonshire Carers.
Okay.
You can certainly broker a connection with Mark, who's also one of our governors. So yeah, we can make a connection.
There's connections all over the place, Richard.
Thanks, Julie. Yeah, great idea, actually. Okay, so I don't know whether anybody has any final questions. I'm just going to have a look in the chat in case I've missed anything. Oh, Tracy, would you like to come in?
Yes, I was just going to ask, I mean, it's probably early days, you're a new service, but what sort of feedback you're getting from the people that have been through these sessions so far, and sort of how they found them? Because I'm presuming that might help you with your advertising, because you'll have some good case studies, hopefully, going forward.
Yeah, I think we've had really good feedback. People really appreciate the support. Yeah, I think that, yeah, the feedback I've had, and also from the people that I've supervised, yeah, it's been really positive.
Great, thanks very much. In which case then, as I said earlier, the 6:30 finish was a limit and not a target. So if people don't have any further questions, we'll probably come to a close there. So thanks very much to Nicola and to Fiona for taking us through their presentation and for responding to questions. It's certainly really pleasing to see that we've got something in place now for long-term conditions, and excited to hear about some of your development plans. I think there's been some helpful offers to help promote the service, and we'll broker a connection, as we mentioned, with Mark with Health Watch. So thank you very much. I just wanted to highlight to those that are participating in these member webinars, just what's coming up on the horizon. So in September, on the 18th, again via Microsoft Teams, at 5:30, we've got our annual public and members meeting. It's also the annual general meeting of our Council of Governors. All are welcome, and you'll get to hear about some of the work that the Trust has been doing broadly across the last year, some of the work that the governors have been doing, and hear about our plans for next year, and also interact with us in terms of any questions you might have about the work that the Trust is doing. So do look out for an advert there, and you can register with us to participate. We really would love to see you there. In terms of future member webinars, I think our next one is taking place slightly after the annual public meeting on the 27th of September, again in the early evening, where we're going to have a focus, actually coincidentally, on the Recovery College and peer support workers. So you're very welcome to join us for that session. And again, we can register through the Foundation Trust email address that you used to register today, and we can put you on the list and make sure that you get a link for that. And finally, as I mentioned earlier on, we do record these sessions, so as soon as we've just sorted out the recording, it will be available online. So if you did want to revisit any of the conversation we've had today, or to revisit the slide material, please look out for the link to that. And in the meantime, we'll get the slides and other promotional materials out to everybody that's participated. So thanks again to Fiona and Nicola for their presentation. Thanks to everybody else for joining and participating in the discussion. We hope you got something out of it, and have a very good evening. Thank you very much.
Thank you, everyone.
Thank you.
Bye.
Bye.
Thank you.